As a chiropractor, you know that you can make a difference in your patients' lives using hands-on manipulation. So you spend most of your time doing exactly that. However, there are additional ways that you can improve your patient's health. And that's what we go to school for, to learn how to adjust. But we don't really talk about the other stuff, the mental, the physical, the chemical. It just works. And of course, I coach hundreds and hundreds of doctors, and they ask me questions all the time. So I write these emails every week about content marketing, about how to give them things that they can do to help with their patients. So I'm kind of going back to square one about, the triad of healthcare. We're going to talk about that, Dr. D.D. Palmer talked about back in the day. All right, so give patients the complete care they need. As a chiropractor, you probably feel most at ease when adjusting patients. You know that you can make a difference in your patient's lives using hands-on manipulation, hence the word chiropractic, hands-on. So you spend most of your time doing exactly that. However, there are additional ways that you can improve your patient's health. If you watch some old videos of BJ Palmer adjusting patients, it's like, really? I mean, he's moving that bone into another zip code. I mean, it's pretty amazing what they do. And the body's pretty resilient. The body can take, there's Gonsta, knee chest table. I got adjusted in school and I'm thinking, what the heck is going on? I mean, it kind of took my breath away, but it felt good afterward. So there's a lot of different adjusting techniques. And that's what we go to school for, to learn how to adjust. But we don't really talk about the other stuff, the mental, the physical, the chemical. And it just depends on what school you go to. Are they more medically oriented, or are they more philosophical oriented, things like that. And today in the I was gonna say in the 90s, today in the 2020s, I don't know what they're focusing on, and I hope it's the triad. So there's a strong argument to be made that focusing on all three areas of health, physical, chemical, emotional, can give patients the resource they need to achieve the best possible results. So why don't more doctors offer this, as far as the chemical, emotional areas? Because either they haven't been to a seminar, they haven't been trained. Of course, you don't learn it in school. You go to a seminar, you can learn different things. But the problem is doctors will go to these seminars, and the seminars are like, hey, we got a new modality, shockwave. We've got a 60-watt laser. We got all these things to physically treat patients, but they don't really have any seminars how to, very, very little about as far as nutritional, chemical, and then the emotional that we're going to talk about. So though most doctors feel very comfortable working in their core area, which most often address just the physical piece of the triad, they start to feel uncomfortable when it comes to the chemical and emotional aspects of health. It's like, and then go 5 years, 10 years, 20 years, and you're still doing the physical. Are you going to want to, hey, I'm going to add some chemical and emotional and nutritional to my practice, because it's out of your comfort zone. And so you're like, I don't know what to do. So I get doctors all the time that I get to help train who don't know how to get into that. And that's what I do. I get doctors to do those other two components that you're going to learn about. That really helps the patient out really well. So triad health, the 3 T's. D.D. Palmer, the father of chiropractic, actually emphasized the importance of this triad of health care. He called it trauma, thought, toxins, or thoughts, trauma, and toxins, in the class of 1910 text. Classic 1910. The chiropractors is the adjuster. Given the origin of this triad, it's clear that the emotional, chemical aspect of the triad fall well within the scope of chiropractic care. So, like, for instance, chemical. There's this kit that we use for patients that everybody's toxic. So it's a 7-day cleanse through Solutions 4 that I've talked about, that company. And then anybody who, there's a website at the very end that if you want to order some of this stuff, it doesn't cost to be a member. It's only sold to doctors anyway. And then there's Brain Tap. Brain Tap is from a Dr. Patrick Porter. So I've used this technology for the last 13 years, and it's a light and sound machine. So you put the headphones on, and it has these lights, and he records 20-minute sessions. So he's recorded sessions for me for my neuropathy patients, for weight loss patients. So he has everything. And now he's worked with professional athletes. He's working with Tom Brady, in the NFL for concussions and that can lead to Alzheimer's and dementia. So there's a lot of things that they're doing with head mapping, with LED therapy and light therapy, and with the other than conscious mind stimulation that he does. When you're done with this, it basically, if you know what an HRV is, heart rate variability, if you do a HRV before 20-minute session and after, it totally night and day changes. You sleep better. There's brain tap for sleeping, energy, working. I mean, you name it, it's there. Public speaking. Oh, I'm scared of public speaking. No, you listen to a few of these and now you're no longer scared of public speaking. So this is something that I know we have one of my doctors in, I think it's Louisiana or St. Louis, who has a room and he has 10 chairs set up, 10 chairs, reclining chairs, those little zero gravity chairs you sit in. And he's got 10 headsets and patients are paying $75 a month. And they can come in once a week or $100 a month. They can come in twice a week. And that's all he does. I mean, he's generating, a lot of money, over $500,000 a year, just from that one room that he does this. So I'm just saying, if you guys want more information about this, you can call me. The number's on the very last slide. So this is like freaking awesome stuff, to have this. And if you don't want to put this in your practice, do it for yourself. If you're stuck on this and this, you're going, I want to do this better, this better, this better. I know that Dr. Porter's got a program for you. And so amazing stuff. In this article that I'm going to show you later, I'd like to pay particular attention to the chemical aspect of health and discuss a few strategies that chiropractors can use to integrate a chemical approach to their existing practice. Focusing on the 3 stages, immediate care, relief care, corrective care, and then long-term wellness, I'll address how you can reduce your patient's inflammation and accelerate the body's natural healing process. I had a patient last night that came in. I mean, she's on oxygen, and she came in because for neuropathy, and I took a picture of her toes. They're like 73 degrees. They're like 25 degrees colder than what they're supposed to be. And her hands. And I was telling her all these things about chemicals and what to do. And then she's telling me, oh, but I already take all these supplements. I already take B12. I already do this and blah, blah, blah. And so when the patients start telling you, oh, I already do all that, I stop them and I say, okay, would you agree with me that what you're doing is not working? I don't care what you're taking. Because right now your gut microbiome is only absorbing 30, 40% of what you're even eating. So if these products are so good, you're only getting 20, 30% out of them anyway. And then we call it a therapeutic dose. Are you taking enough of that for a therapy? You might need a triple, quadruple what you're already taking to get a result. And so you can adjust them, treat them, with your new shockwave or your new 60-watt laser. They'll feel better, but put some K-tape on them as they walk out of there. But it's going to come back. It's not going to benefit them long-term. And then they're going to go find somebody else because you didn't help them. So for immediate relief, anti-inflammatory diet is essential. I've talked about this before a month or two ago about some orthopedic surgeons. Before they do a knee replacement, they're actually putting patients on 30-day anti-inflammatory diet, and then the patients are having a better post-operative success. Because people will die in surgery because they threw a blood clot, not because the surgeon screwed up. It's because the body wasn't healthy enough to go under the knife. Okay. So this means that your patients will need to cut out foods that cause inflammation, especially refined sugars, refined flour, refined vegetable oils, canola oil. Read the labels: canola oil, safflower oil, vegetable oil. Get away from that. So if it basically comes out of a box, a bag, it's going to have the crappy, cheap oils. I mean, even Whole Foods has crappy products. Just years and years ago when Whole Foods started, it was kind of like the new Sprouts or the new Trader Joe's, but now that Amazon bought them, they're trying to just generate income, and they've cheapened their products. So it's no longer Whole Foods. It's just still the name, but they've got, just go to the deli at Whole Foods and just ask, oh, that looks good. Can you tell me what's in there? Canola oil. What's in this one? Canola oil. Inflammatory foods. But yet we're at Whole Foods. It must be good for you. No bueno. No. So while introducing foods that help quell the body's inflammation process, we need to increase good omega fatty 3 acids and fibrous vegetables, plant-based. Fiber is the secret weapon to pain management. So remember, Google microbiome joint pain, microbiome DJD, microbiome rheumatoid arthritis, and you'll see the direct link to this. It's just not me making this stuff up. I stumbled on it 23 years ago, before it was a thing. On top of this, it can be especially helpful for patients to limit their intake of heavy foods, such as red meat and potatoes. There's a doctor called nutritionfacts.org. Dr. McGregor, nutritionfacts.org. And he talks, if you Google cancer and red meat, and he'll show you from studies that red meat is what mostly causes colon cancer. It's like, and inflammation in the body. And potatoes, potatoes, who doesn't love potatoes? My favorite thing yours would be hash browns with fried eggs and some Cholula sauce, not Tabasco, Cholula. And then, of course, potatoes increase, because of the glycemic level, increase your blood sugar like this. So no, I don't do potatoes anymore for years now. So, and then we had talked about patients do a cleanse, like the 7-day cleanse I showed you earlier. So the results, and then I have a 20-day anti-inflammatory program. It's called the 20-day rejuvenation for patients that any kind of chiropractic care, decompression therapy. So you put them on this program, it starts to decrease swelling, inflammation in their body, which decreases pain. Now you're the one that's finally got them to get out of pain because you're working with the chemical side of that triad of healthcare. It's not that hard. You know, you just have to do a few things, and you're gonna have these raving fans. Your patients are gonna go, oh, you're doing what other doctors did not do to me, and I love how I feel. Now, guess what? They're gonna be lifetime patients if you want that. So at this stage, supplementation is key. Supplementation. In fact, 2002, the journal JAMA, Journal of the American Medical Association, came out. It's like they consented. I consented. I lost the race, you know, like the presidents do. But they consent. They said, yeah, everybody should be on a multivitamin, because you know we're not getting the nutrients. Why aren't we getting the nutrients in our food? Well, you know, I used to think it was the depth of the soil. Is it organic or not organic? It's actually the microbiome that's in the soil. That's what feeds the plants and gives it the plants the quality of nutrition. Especially patients, you know, suffering from acute pain because of inflammation. High quality omega-3 supplement, a variety of anti-inflammatory botanicals, turmeric, ginger, garlic, and vitamin D. Vitamin D and omega-3, especially wild sockeye salmon oil, have been shown that it's just as effective as NSAIDs, non-steroidal anti-inflammatory. And there's no side effect to this. And that's, by the way, that's vitamin D3. If a patient is suffering from back, neck, or knee pain, you may also want to recommend some kind of cartilage builders, MSM, glucosamine, chondroitin, combined with the anti-inflammatory nutrients and diet. So these supplements will work synergistically to accelerate the body's natural healing. Okay. And there's that solutions4.com. It doesn't cost money I don't own that company. I'm just saying that's what I use. And I love it. I get great results with that. So here's one this is one of my faves for patients with pain. For immediate relief, this anti-inflammatory diet is essential, but I would also recommend the same anti-inflammatory diet. But at this stage, you may want to give your patient a little bit more freedom. You know, we talk about good, better, best, you know, talk about cleansing, make sure they're eating more of a healthy diet. And then for supplementation, I recommend this product that has alfalfa, yucca, licorice root, burdock root, devil's claw, prickly ash, multiple herbs so like if I do anything at nighttime, or during the day, and I get a little sore, you know, I'm 63, but I get a little sore if I'm packing around my 30-pound son on my back. I'm like, dude, stop growing. And so I take like 3 of these. It's like Advil. Sometimes it almost feels like an Oxycontin, you know, because I feel like I'm floating. This feels pretty good. I like this. So I love this stuff. And so you should get your patients on this. They're going to love it. And they can only get it through you anyway. I also recommend high quality omega-3. See that omega-3 fatty acid right there on the bottom left? That's salmon oil. Because if you just try to go buy fish oil, look at what fish oil that you buy from, you know what the number one seller of herbs is? Yeah, what was it? Walmart. Yeah, you got that right. Walmart. And then if you go to Costco, like before you're checking out, a quarter of the store is all these supplements. You're like, what the heck is going on here? You know? And the problem is the FDA doesn't regulate any of this. Well, the FDA has been into Solutions 4 and they've actually tested everything to know that it has. But if you look at fish oil, you're going to see fish oil that have sardines, I call it holy mackerel, and then anchovies. It's kind of a crappier, lower quality oil, where salmon oil here is actually sockeye salmon. So what they do is up in Alaska, they have these little fisheries. You know, like cows go in and they get milked and for milk. So what they do is they have these little fisheries where salmon will swim through. The salmon will caught up in this little cage, and then they milk the salmon of this oil. No one teases it. They don't do that. Had you thinking there, didn't I?
Yeah, you did. I'm like, whoa, this is a very interesting process.
Yeah. No, but I mean, I could tell patients that. They go, oh, really? Yeah. So, you know, they'll believe what you say. But no, they don't do that. But the sockeye are vegetarians. That's why their oils are much better for the body, because they're vegans. Okay, all right, they're plant-based. And then we have the vitamin D3 chemicals. So we have regular exercise, stress management, and now there's a big thing on leptin resistance. And maybe we could do a video or a webinar about leptin resistance. There's insulin resistance, but just as important as insulin is leptin resistance and why people have a hard time losing weight. So maybe we can look at that later. Stress management, the SMT, the light and sound machine you listen to, stress management, because you really can't decrease your stress. What really helps is if you exercise and eat a better plant-based diet, that'll help your stress chemically, you know, but an exercise will help that too. Like I just got back from the gym. And there's very few people in there above 6 years old at a gym. They're all a bunch of young people, you know, very few people walking around with white hair on their face, I actually met a lady today who was 70. I said, "How old are you?" You don't ask a woman, but I did. How old? I'm 70. I go, you know what? I gave her, hey, good job. I'm proud of you for doing this. I've seen her there. We always say hi. And then sleep. You got to get some good sleep. And so in here at the very far right, they have some great melatonin here for sleep. And you take one of those or two of those before you go to bed, half hour. Bam, sleep like a baby. Because if you're not sleeping well, your body can't recover. It's all about recovering and regenerating, get ready for the next day. So it's a whole thing where if they're not going to eat, change their diet, at least they can supplement them to move up and decrease swelling inflammation, but try to give them some good, better, best eating. So anybody who wants some of the formulas or anybody wants the good, better, best eating that I give, you can text me and I'll give me an email. I'll send it to you what I have. Long-term wellness. Ultimately, you want all of your patients to maintain their results for the rest of their lives. As doctors, we sometimes lose sight of this and focus on improving our patients by reducing acute pain. So remember, years ago, I had 2 clinics, 75 employees, MD, DC, PT, nurse pracs, PAs, and we're doing pain management. We had everything, unweighting, we had work hardening, work conditioning. I mean, all my 8,000 square feet, but we're only helping 70% of everybody. And that's when I started testing these patients on a machine that I have. It's called a biomeridian, because I want to, okay, so what's going on? Because blood test's not going to show it. But I found out through looking at the meridians through this machine that the microbiome, before it was a thing 23 years ago, this was weak. So I put them on a nutritional program to get the gut healthy, and they're getting out of pain. So guess what? I don't do all that anymore. I don't do all those therapies anymore. I do some decompression, but while they're on decompression, I do the 20-day rejuvenation anti-inflammatory program to increase the disc height. Because if you don't get good nutrition into the bloodstream, it's not going to rehydrate the disc. Okay. As long as they're coming in, yeah, they're going to feel better. But if you don't do something to decrease swelling inflammation, okay. To promote long-term wellness, you want patients to transition into a maintenance diet that is less restricted, but still prohibits the most inflammatory foods like, refined sugars, flours, oils. Encourage the consumption of anti-inflammatory foods, fruits, vegetables, lean meats. Like over the weekend on Saturday, I went and bought a case of peaches. Like right now, you can get these amazing peaches. Oh my goodness, amazing. Just a month or two a year, they're available. So I just probably eat like 2 a day. They're so good. You also want to learn to transition into a maintenance dose of some of the supplementation, like omega-3s, good fatty acids, essential fatty acids, and multivitamin, multimineral, and a good vitamin D, even if it's summer or winter. Okay, eat better, feel better. As a chiropractor, it's easy to become caught up in providing immediate relief while forgetting about corrective care, long-term care. The problem is if you're doing personal injury, these people are just coming in, getting treatment, and you talk to them about this. I don't have money for that. I have insurance, and so I'm just here for the treatment because I'm going to get a settlement for like whatever. There are certain things that you can do to prescribe to them, because if you do this, and this, you're going to get so much better results and better care, and you're going to heal faster. So it isn't always easy to see below the surface of an issue or ask questions about diet, even though this is essential when treating someone holistically. So I like this. I must be eating at the very bottom right. I must be eating right. I'm narrow at the top and wide at the bottom, just like the food pyramid. The food pyramid, that's what they teach in nutrition and in colleges, universities, the pyramid. And it's basically crap. It's like if you have a heart attack and you go in and meet with a nutritional counselor in a hospital, they'll put you on an American Heart Association anti-heart attack diet. Guaranteed within 5 years, you're going to have another heart attack, because they're going to say, you can eat breads, but make sure it's whole grain, crap like that. No, breads are not good unless you're in Germany. My daughter just came back from Germany and she's like, Dad, the bread here is amazing. If you don't eat it within a day, it goes moldy. So here in America, no, that bread's going to sit on the shelf for like a year. Twinkies last for 1,000,000 years, so it's it's not this. So that's why we do training your staff and the doctors how to coach your patients to doing a better nutritional program. And then you're going to, like I say, they're going to be raving fans of you. Personally, I'm willing to admit that during my first years as a chiropractor, the physical aspect of the triad received all of my attention. I was only physical. I was only getting out of pain. Didn't even introduce the rest of the stuff until later. I thought, okay, how come everybody's not getting out of pain? So operating this way, I eventually came to realize that some of my patients weren't progressing unless I addressed the chemical aspect of their health. Their bodies would never heal. Once I noticed this, I started incorporating nutrition into my treatment protocols. That made all the difference. I had a huge rehab center and doing all this stuff, charging per unit. So we had a time clock and we had these little cards. So they would go in and they'd punch in. Now, if they worked out over 8 minutes, you could bill 1 unit, but they had to work over 24 minutes and you could bill 2 units. So that way we knew we were compliant. So if a patient only worked out 23 minutes, you could still only bill 1 unit of therapy. So you need to look at that, if you're going to ever get audited for when you're billing, 2 or 3 units on physical therapy, 97, like a 112, 97110, those kind of codes. So by incorporating nutrition, I was seeing night and day difference, even better results than all this equipment. Sorry. Now, ultimately focusing on the physical, chemical, and emotional aspects of care will not only help your patients, it will also boost your bottom line. Adding new treatment options will help you build a steady stream of recurring revenue that you can use to build the practice of your dreams. You may have to venture outside your comfort zone, but I promise you it'll be well worth it. And that's where you get them on the nutritional stuff that they can't buy it anywhere else. They can only get it through you. And then they stay on this. So even though they came in, for 3 months, they're still buying products from you. So you're still generating income because you showed them what they need to do to be pain-free and to live more of a healthier, fuller life. Okay. Here's some references. You can go back and look at where I got these, the fish oil and anti-inflammatory stuff, that an alternative to non-steroidal. And then the mind thing, mindfulness meditation. So yeah, I've been doing this for 33 years. If you have any questions, you have to get with your coach or Angela and schedule a time with me on a Friday or Monday. But I can see what you're doing and kind of give you some tips, because I've been doing proactive for a couple years now, and I got thousands of leads, and I kind of have ways to follow up on them. And I actually have done some videos with Angela here, how to get better compliance and how to get better follow-up. If you want some help with that, let me know. There's my bat phone, the 801-903-71401. That's my bat phone. Remember Batman? He had a special phone with Commissioner Gordon. So that's my special phone to doctors. And then that's my email. And then that's my singletonsystems.com, and then solutions4.com for the best products I don't own that company. I just love them. They're great. And it's a family-owned company for now 45 years. So the formulations are amazing, because if they were to sell out, they've had big companies want to buy them out, but then they would have cheapened it. Like Walmart was purchased by Amazon, and then now it's this. So we just have to find good nutrition, because the last thing you want to do is have a patient come in and say, oh yeah, I was going to get that, but I actually bought it online. You're like, well, I was the one that showed you how to get healthier, so you want to have something that patients can only get it through you. So I hope this was good, and I hope a little bit of review from some others before, but the triad of healthcare, trauma, thought, toxins, if you focus on this, if you need some help with that, let me know, schedule a call, and I'll help you.